Dear Medicos, we are having the proud moment of having Dr. Shashank with us, ranked 83 in NEET 2023. So, beta, we wish you, we congrats you on this big achievement. How you're feeling now, beta?
I am feeling very happy, sir. This is a very proud moment for me. And I want to thank my parents who have been a constant support for me. Also, my sister and my brother-in-law who initiated me to go to DAMS specifically. All the faculty of DAMS and my medical college, my friends, especially Dr. Anjali, who has been a constant study partner. I'm feeling very happy right now.
Great,
Yes.
great. Rank 83 is a big achievement, beta, and this will be, I think, even after a few years, this rank of 83 now will motivate you. Okay, this is the best achievement, beta. So we are
Yes,
very
sir.
happy. We are happy for your success. And like now, I want we should use this platform to share all the success story and how all the juniors who are listening to you, beta. Like, what was like when you joined DAMS? Like, in which prof you joined DAMS? Beta?
Sir, I joined. I'm a foundation batch student, so I joined in my third year. Um, so I was a foundation batch student, and I used to attend offline classes. So then the next year COVID happened, but still I stuck to DAMS, and then I used to listen to online classes. And then my first attempt, I could not get the rank which I want. So I followed it with DAMS TND, and then I cracked this year NEET. So what I feel is offline classes are the ones which made difference for me. When I came and attended the classes, I knew the kind of competition around me, and I knew where exactly I was, and I knew how much I had to study more to get into the race. And sir, I specifically remember your class when you came and told that it's not how much you study, it's the number of revisions that's gonna matter. And that stuck in my head very hard. And I strongly believe that. And I made notes of all 19 subjects from DAMS, and I didn't use any other platform to make notes. And I just revised from those notes multiple times. That helped me achieve this ranks.
That's great, Beta. We
Yeah.
congrats you. We congrats you. And after listening your word, like we are very happy for because you had faith on DAMS, you stuck to DAMS because in COVID era, what I feel as a faculty, as an educator, what I feel, many students they were feeling like in COVID we will study for 24 into 7 and we will do bulky
Yes.
notes and everything, but that is not practically possible at the end of the day. And what
Yes, sir.
I think from your words, you stuck to DAMS concise class notes, and that's great. And even after you couldn't perform well, you realize, yeah, it was lack of revision. We have to revise it again and again, and you join our TND. That's best decision, beta. I congrats you, your family, everyone for this big achievement, beta. That's great.
Yes.
So now coming on the classroom experience, better like you were sitting in that DAMS Bangalore classroom. How was the feeling? That classroom is
Yes.
best. It is like a perfect classroom of a school. So you feel, yeah, I'm sitting like a 10th standard, 11th
Yes.
standard. So it give a positive energy, that classroom.
Yes, sir. Classroom experience was very good. Initially, it was little difficult sitting for so long, but then slowly we got used to it. As I said, the main thing in the classroom is you are interacting with the teacher in between. The teacher is looking at you and speaking, and then there are a lot of other students around you who are interacting with the teacher, and you know at what level you are when you are at the classroom. So you can feel the competition when you're in the classroom, and you'll have that motivation to come the next day and answer better. All these small things which you can't get from online teaching. That's the best part about attending an offline class. And it really helped me to boost my preparation, and it actually it made me realize key where I am exactly, and how much I need to work. So there are many small things which are there in the offline experience that will help. That actually helped me a lot, sir. Yeah.
So but in the classroom, when you were writing all the notes, that experience,
Yes.
not like even you were appealing for last NEET
Ah.
examination, any special moment you remember, yeah, this was in the class, they were telling like this
Yes.
any moment
Yes, sir.
share?
Yes, sir. So there were many moments when I realized I used to write, and sometimes they used to ask us a question, and then I used to utter it wrong, and then I correct it and write it in my notes. I remember that point. Key in the class, I thought it was like this, but then it's not like this. And then writing notes are also very helpful for me, because since I wrote my own notes and I've underlined, I've marked it with different colors of highlight, different highlighters. All these things, kind of helped me in the exam, because by the end of the preparation, I knew exactly on what page and what section of my notes that exact point was, and that helped me to answer the question much better, and get to the options much quicker. So this was a very good experience, which will come only with an offline teaching, I believe.
Everybody is interested to ask one question: how many times you revise the notes, beta? How many times?
Yes, sir. I revised 4 times, sir. Um,
Great.
yes. So the first time till my internship. After my internship, again revised another 3 times with TND once, and then after TND another 2 times. So overall, it was 4 times.
Where you rate the MCQs of TND with your NEET examination, if I compare the MCQs of TND against NEET?
Sir, I feel that they're very close to whatever has been asked in NEET. It's not just TND question. I used to solve class tests. I used to solve subject-wise tests, and especially with the new tests which DAMS used to upload from 2021, the questions are very close to whatever has been asked in the NEET, especially with the clinical pattern of questions. I think the faculty of DAMS really put in effort to get the real-time experience of what exactly is happening in the main exam. I feel that even the questions are not exactly same, but whatever the concept they have stressed in the class, especially the discussion part, which was taken in TND session, those points really helped me during my exams.
That's very good. I like ample practice of the MCQs, and MCQs should be doable. MCQs, what I feel, okay, the MCQs should be doable. Those should be related with your notes so that you can learn how to apply the notes.
Yes, sir.
And coming on the last spell, you must have attended DVT. How was the experience of that DVT in your success journey, bit of this rank 8-3?
So DVT was a major, like a major life changer for me. I can show my
Big
notes.
smile. Arey,
This
that's
is my workbook which I made.
you show this book again, but I want every medico should see the way that you have put those colorful.
Yes, sir.
Yes.
This is my workbook. I made sections everywhere. I revised this book a lot of times, especially all the dry subjects. I don't mean dry subjects. I mean the subjects where I need to revise a lot, especially biochemistry, PSM, OBG, all these subjects. And then in the end, I just revised all the subjects again. And the images were very good, sir. The last 1 week, I just revised my DVT book. uh, I actually wanted to stress on this workbook, which is very good. Is a new initiative taken by DAMS. Previously, it was only a teaching thing. Now, since it became a workbook, and again, since I made notes with my own handwriting, it actually helped me a lot. Images were very good, and then the way they concised into tables was very good. Like, I would recommend every other person who's preparing for NEET to get workbooks.
That's great. Thanks for your kind words. And
Yes,
I wish every student, every junior listening to you should take a motivation that how nicely, how beautifully you have planned all the things here. The systematic preparation is need of R is the key to success, beta. And you had done very nicely. I appreciate your effort, beta. The workbook was effort of all the 19 faculties, but the way
yes,
you use that effort, that is recommendable, beta. That's great, and we congratulate you again for this big achievement. Now, beta,
yes.
coming on the last spell, what was the experience of PYQ in your success journey?
Uh, so PYQ was I feel that I've given both INI CET and NEET PG. I feel INI-CET, they tend to ask a lot of previous questions, and many of the questions are just like a direct repeat. Even the options are like direct, same to ditto option. But NEET, I feel there are a lot of PYQs which were repeated, but then not exact same wordings, exact same language, but the topic is more or less similar from the past year questions. Um, so in terms of previous year's questions, I feel for NEET, if you solve previous year's questions, you'll know what topics they're stressing a lot on, and then you can expect the same topics, but not exact same questions as we see in INI. INI, it's like some of the questions are like direct repeats from the past year questions. But NEET, I feel that everyone should do previous year's questions so that they'll get a hang of what topics they're stressing a lot on, so that they can concentrate on those topics in the end.
Any special strategy, beta? Like which subject should be given more preference, and what should be the first line of batsman? What should be the second? What your opinion regarding this NEET preparation?
So when I gave my first NEET, I understood that I need to stress a lot on first year, second year, and third year subjects, which because these are the kind of subjects which, if you know and if you have revised it properly, you can definitely answer it. It's not like medicine and surgery, which is a lot of clinical based, and then that this first year, second year, and third year subjects are the ones which will help in getting us those ranks also, especially subjects like PSM, forensic medicine, ENT, ophthal, and then biochemistry. All these, if we can study it properly, because the syllabus is limited and there is no new protocols or anything like that coming up as we see in medicine or surgery. So since there is limited syllabus, and then there are a lot of questions coming from that, if you can target these subjects properly and get most of the questions correct in these subjects, I feel this will definitely give us an extra edge over others. Rather than focusing a lot on medicine, surgery, I feel we should focus a lot on first year, second year, and third year subjects.
Very true, very nice. Or your advice you are giving to your juniors. And but that is my non-academic question I'm asking from you. Okay, what change you felt like after attending the DAMS classes, the way you were studying before joining, and the way you start studying after? Any change in your personality? Any change in your learning methodology? With
Sir, I would take this opportunity to again quote your strategy, your class. I still remember. So before I joined DAMS, I just used to study textbook. There was never this concept of concising things. So I think especially after attending your class and then many other faculties class, but then I remember your class more, because you mainly stress on this concept of concising how much ever we learn, concising whatever we have learned into simple terms, which we can revise in the end, is gonna get us a good rank. So the way the change that happened after I started coming to DAMS was that I understood that's not how much we study, it's about how much we concise and how much of quality notes we are making, that is going to help us in the future. So that is how my perception about changing and preparing for a competitive exam happened, especially after coming to DAMS. This is the major one, sir.
Thanks for these kind words, and we are confident, beta. Whatever branch you will choose, I'm confident you will excel, beta. You will be reaching on the next
Yes.
level. Definitely, the way you are discussing, way you are telling us, okay, this the method. No doubt, it was your 1 year, like as a post intern, you crack this rank 83. But this 1 year will pay you in the upcoming years, beta. But
Yes,
the way
sir.
you are maturely, you are telling everything. It will help you in the post graduation, and we are confident.
Yes, sir.
Any special message for your parents, beta? At you initially, you thanks them that because of them you are on this chair. Any special
Yes.
message for your parents, beta?
So both my parents are medicos. So from the time I remember, I think I've been seeing them as doctors, and I come from a doctor's background. So they are the ones who initially inspired me to take MBBS and then pursue doctor's field. And then especially my mom, she's an gynecologist, and then the way she treat patients, and then the way patients come back to her and thank her for whatever is happening, whatever the success they got from the treatment, actually, inspired me to take medicine. And then I understood, this the amount of respect that she got in, can be, it comes only with the doctor, not like any other field. So that part, that aspect of life where you're getting respect from other person for the work you're doing, this kind of perspective about life I got from my parents. And they are the ones who put these things in my head. And that's how I started in my MBBS journey, and I'm continuing it. For this, I am very thankful for my parents for this aspect especially, and they've been there for me constantly throughout my journey. Even when I'm preparing, the times when there was a lot of time during preparation when I was very down, I couldn't study a lot, then they used to come to me and tell, it's okay, and like, we are not bothered about results, you just need to work on whatever you're working. They showed confidence in me, and that's why I was able to study freely. There was not so much pressure on me to study. They always had confidence in me that I will success. So all these things, I'm very grateful for my parents.
You convey our regards and congrats them, beta. This is their achievement. Your rank 83, what I feel that this is their achievement, and please convey our regards to them.
Yes, sir.
And thanks a lot. Thanks a lot for coming on this platform. We are taking lots of interviews, but the way you are a gem person, right? And we wish you very best of luck. Thank you.
Yes,
Thank you for coming on this platform.
thank you so much, sir. Thank you so much.